I'm Dr. Lane Sebring in Wimberley, Texas, and I have a clinic, the Sebring Clinic. We practice a very different style of medicine here. It's orthomolecular medicine. We use the body's own chemistry. We de-emphasize medication. In fact, a lot of our goal is to get people off their current medications and show them how to live a life and a lifestyle that prevents and can actually reverse disease.
You know, this is a real different experience. My whole professional life has been revolved around healthcare. I ran hospitals, built hospitals, ran medical groups, built medical groups. So I've had lots of exposure to healthcare in general. And when I moved to this area of Texas, I was checking with people about who a good physician would be to see. And one of my chief operating officer, actually, for the company I was running, suggested I come see Dr. Sebring. And so I came up and visited with him, had an appointment, and spent well over an hour sitting in talking to him because he wanted to know what made me tick, what I did for a living, and what my family life was like, and what my schedule was like, and how things were working for me as an individual with my health.
I now have 15 years of experience practicing this way. The nutrition conferences that I've attended over the years, my patient population willing to work with me, I now have the strength and the tools to almost always use a nutritional approach to their chronic medical disease. And then we can actually eliminate that disease in most cases.
Well, it's kind of like going to a little resort, you know. There's waterfalls out front, and it's in a nice wooded setting, and the people are very nice. I've had good relationships with the staff here, and much different than a sterile kind of environment you see a lot of times in medical practices.
From the moment, you know, that I come in and I sign in, you know, it's very, the receptionist is always, you know, hi, how you doing? You know, it's not just sign your name, we'll get to you in a minute. It's very people oriented, and they really want to care about you and what's going on with you.
What I think is important for people to know about our clinic and what we bring to them is we teach them how to be healthy so as to decrease their need for modern medicine. That is our goal, and we're able to do that in almost all instances.
I'm Susan Parker Lee. I'm a certified clinical nutritionist. I do the nutrition consults here at Sebring and also work here in the paleo pharmacy. We call it paleo pharmacy because everything that we have is consistent with the paleo lifestyle. We have a wonderful selection of books that are all dealing with paleo. These are our clients' favorites, and they're ones that we have chosen because they are consistent.
He wants to know what's going on. He goes and does the blood work related to that, sits down and explains, this is what's happening in your body. This is what's going on with you right now. If we go in and we do this kind of work there in terms of supplements, looking at how you eat and treating yourself better, this is what's going to happen for you. He predicts the behavior, and I put that into place, and he was exactly right. I lost a lot of weight. I gained a lot of muscle. I had more energy, I had more coping capabilities because I did stressful kinds of work and building companies and so forth. It just made an entire change in my life and who I was. And so he's picking it up from the biochemistry of what's going on within me and saying, here's what you should be, or you're probably experiencing these things. And it's sort of mind-boggling that he really can say that without me giving him the hints that that's occurring within me.
In the sense that I'm really trying to make changes throughout my entire lifestyle. I'm trying to not only nutritionally do better, I'm trying to do more lifestyle things as far as fitness is concerned. Stress is a big thing for me, and as it is for most people. It takes a lot for someone to say, hey, change a little bit so you'll do better. You know, and Dr. Sebring, you know, has really brought that to my attention. Where most doctors, it hasn't even really come up. Yeah. And it's something we all deal with on a daily basis.
You know, I think that like all of healthcare, we have some personal responsibility. He can give me all the information that I need. He can tell me things I don't sometimes quite understand why they work the way they work, but that they work that way. But it's the relationship that drives the motivation. If you do these things, you're going to experience these results. And when you do them and you start experiencing those results, it gives you that ability internally to say, well, if I'll just hang with this, if I will commit to it as much as he's committing to it, there's going to be a change. And there's just been huge changes in my life.
I think what sets us apart is the fact that I understand traditional medicine. I was trained in that, and I am an MD. And I practice that medicine, but that's the last choice. And almost never need to go there. After having learned the aspect that nutrition brings to health, and how once you learn to do that as a physician and use those tools, you don't need the other. So I've expanded my knowledge beyond my peers. If you're interested in learning how to take care of yourself so that you are more self-directed in your health care, we teach you how to do that. It's very simple, amazingly simple. And we respect you and your genes and your chemistry. And those people who are interested in that approach, look us up. We're at sebringclinic.com, or it's 512-847-5618.